Let's study about clinical features of Cushing syndrome. We remember the clinical features of Cushing syndrome as glucocorticoids. The same mnemonic can be used in two ways. One, we can use this mnemonic for the glucocorticoids side effects. Second, we will remember this mnemonic for this Cushing syndrome. So let's start with gluco. G stands for glaucoma. Glaucoma, we will remember something called as GTCS. G stands for glaucoma, T stands for topical, C stands for cataract, S stands for systemic. Whenever we give steroids as a topical, it leads to glaucoma. Whenever we give steroids as systemic, it leads to cataract. L refers to limb muscle atrophy because there is a muscle protein breakdown will be happening in a periphery. Then U stands for peptic ulcer. Peptic ulcer occurs because there is increased gastrin, decreased mucus and decreased prostaglandin synthesis. So there is increased acid production and decreased mucus production. So that will lead to formation of ulcer in the stomach. Then C stands for cataract. As we have already stated, cataract is because of the systemic side effect of the steroid. Then O stands for osteoporosis because glucose causes increased resorption and decreased synthesis, so which leads to osteoporosis. C stands for Cushing-Weird's facies. C also stands for coagulation defects. There will be hypercoagulability will be present. O stands for osteonecrosis. There will be avascular osteonecrosis will be happening. R stands for renal failure. T stands for TB. There will be ileocecal TB. The person will be predisposed to the ileocecal TB, which is mainly because of glucocorticoid excess, that is drug related. I stands for infections because of immunosuppression. C stands for congestive heart failure. O stands for edema. I for impaired healing. D for diabetes mellitus. S for severe psychiatric illness. And S also stands for striae, which are greater than 1 cm. We have to remember they should be greater than 1 cm.